this webinar, I would like to acknowledge the traditional custodians of the lands across Victoria, and especially as we're meeting in this online space. So wherever we sit, we are all on unceded Aboriginal land, and I pay respect to elders past and present, and to any First Nations peoples who are joining us today. I would like to acknowledge the Aboriginal women who have their stories around sexual and reproductive health, which have been shaped by the impacts of colonisation, and to express the hope that by listening to the voices of women, we can move towards a health system that prioritises person-centred, culturally safe and equitable healthcare. Please use the chat to let us know which First Nations country you might be joining us from today. Before we begin this webinar, I'll get into the content of it. It's important to note that sometimes the subject matter around sexual and reproductive health can bring up difficult feelings and memories. So if you're affected by any of the stories or the content presented here today, please don't hesitate to reach out to the support services which are posted in the chat. So welcome. Welcome to the launch of the Long Story Short video project. I'm Tricia Curry, the CEO of Women's Health Loddon Mallee, and a special welcome to Lou, who's making sure that we are Auslan, using the Auslan language in this launch. The Long Story Short project's all about reshaping the narrative of women's sexual and reproductive health. And this project's actually in its second iteration, and it's been renamed with a new focus on the experience-based solutions. But how did we get to this point? In 2018, Women's Health Loddon Mallee and Women's Health Goulburn North East partnered with support from the Murray the Murray PHN to collect women's stories about their experiences when seeking care for their sexual and reproductive health in regional Victoria. Through this collaborative project, which was then called Storylines, we heard that access to services was often very limited, and that the journey from experiencing symptoms to receiving a diagnosis and treatment or a management plan was often a very long one. Women told us about the shame, the stigma and the sexism that they experienced. They explained feeling dismissed and ignored, anxious and resigned to long wait times, inconvenient travel and exorbitant expenses, often unaffordable. Some women reflected on the inadequate education and resources around sexual and reproductive health available to them. And at the same time, in these same stories, evidence of dedicated healthcare providers supporting positive sexual and reproductive health outcomes, and hindsight reflections on what went wrong, what was learnt, or what could be improved, were also heard. There were hints of a way forward in improving sexual and reproductive health for women, girls, and gender diverse people in rural and regional Victoria. And so the seeds were sown for a second iteration of the project. So through our long-term partnership, and it's wonderful to see a number of the staff members from team members from both Women's Health Services here today. So across our two regions, which is basically the north and the west of Victoria, we were able to engage with rural and regional communities with diverse needs. Partnership work within the women's health sector is so valuable in understanding the health needs of women collectively, and in a place-based context to understand how we best apply the breadth of qualitative data in planning, resource development and advocating together for the needs of women and gender diverse people in communities across this part of Victoria. It's now my pleasure to hand across to Renata from Women's Health Goulburn North East.
Thanks so much, Tricia. I'm joining from the lands of the Yorta Yorta people, and I'm here today representing Women's Health Goulburn North East on behalf of our CEO, Amanda Kelly. And thanks so much, Tricia, for that overview, as it brings us to why we are here today. The Long Story Short project takes lived experience as its central focus. We adhere to the idea that women's stories contain data most relevant to understanding what they need to improve their own health and wellbeing without prioritising bureaucratic processes or political considerations. In 2023, we wanted to build on what we did with Storylines and to apply a strengths-based approach. To that end, the partnership drew up plans to come together to hear women's perspectives, this time with the aim of drawing out those solutions embedded in their stories. With a boost to funding received in the 2022 budget, the partnership forged ahead with Storylines 2.0, Long Story Short. In addition to gathering stories from women and gender diverse people around the region, we used a range of supporting data collection methods, drawing on the Victorian Women's Health Atlas and the expertise of Bendigo Community Health Service to understand the sexual and reproductive health landscape across our regions at a population level, as well as consulting health professionals and reviewing the existing literature. Most importantly, all this work was informed by a community advisory group, which identified 5 key themes common to experiences of sexual and reproductive health care. These were access, privacy, stigma, education, and innovation and networking. The final project stage saw us engage with women to hear their experience-based perspectives, asking women to reimagine their experiences in a world where women's health and wellbeing is prioritised, exploring what would have supported them better, assisted their access, and facilitated improved health outcomes. Today, you are going to hear some of the qualitative data we've collected in narrative form. These themes in these stories span across the Storylines and Long Story Short projects. Some promising progress has been made since the collection of stories in 2018. However, many of the same issues remain. The 3 videos you're about to see feature actors presenting stories that have been inspired by what we're hearing from women. By sharing these stories, we hope to spur discussion as well as action. I'll pass over to the Long Story Short team to unpack some of the solutions identified through these perspectives. And the first story we're going to show now is told by Jane, who shares an experience about perimenopause.
Some years ago, I started experiencing some worrying symptoms, and even though my first thought was menopause, I dismissed it almost immediately. I was only 39 at the time, and my admittedly limited understanding was that menopause didn't hit until your late 40s or into your 50s. I was waking up at night feeling hot, and my periods became erratic, my breasts were sore, and my libido was practically non-existent. And the whole thing just felt like this emotional roller coaster. Of course, I knew I needed to go to the doctor, but I kept putting it off. And eventually my partner made an executive decision and organised the appointment for me. We live regionally, and although there are a number of clinics in our town, there's usually a few weeks wait time if you want to see a specific doctor. And after months of anxiety, I finally saw my doctor, who ordered a few tests just to rule out anything serious like reproductive cancer, and ultimately they weren't necessary. She determined that I was going through perimenopause, which is the stage before menopause. She told me it usually begins in the early 40s, but it isn't too out of the ordinary for the symptoms to start earlier. I never even heard of it. And she gave me the information and went through treatment options and lifestyle changes that could help, assuring me that everything was normal and we'd manage it together. And from what I've heard from other women since, I was fortunate to have a really supportive and knowledgeable doctor. Others I know haven't been so lucky. I wish the story ended there, but actually I had a few other hurdles to jump. I've been at my job for over 3 years and thought I had a really good relationship with my employers. But they were not sympathetic at all when I requested lighter duties or time off. I feel like better understanding of women's health is needed, especially around taboo subjects like perimenopause and menopause. Women should know what to expect before they reach the age that symptoms commonly occur. And I also think that more workplace support for people experiencing reproductive health conditions like perimenopause and menopause should be put in place.
Hello, everyone. I'm Catherine, and I'm on the Long Story Short team at Women's Health Goulburn North East. So Jane's story brings together a couple of different themes and common experiences we've heard through Long Story Short around the topic of perimenopause and menopause. When we receive formal education around sexual health, it is generally in a school setting and, suffice to say, does not include much at all about sexual and reproductive health in later life stages. On a broader social level, this story conveys that there is not often space made for conversations around perimenopause and menopause within the community. This narrative plays into the theme of stigma as well as education. And of course, ageism can come into play in terms of people's comfort levels discussing sexual and reproductive health issues affecting older people. So what are the solutions presented that we can take away from stories like Jane's? Collectively, we need to engage in greater coordinated health promotion campaigns to increase public awareness of menopause and perimenopause symptoms, including the impacts on mental health, and also around the treatments and available supports for women. We need to normalise these conversations in the workplace and community and to develop easy to understand, comprehensive and place-based resources accessible across a range of settings. Partnerships between government and organisations like ours, that is within the women's health sector, could be an effective conduit to develop workplace capacity building and policy reform in this area. Appointments with GPs can be a good place to talk about perimenopause and menopause, but of course this is dependent on things like continuity of care and access to longer appointments, which can be more costly or harder to come by in rural communities. So these areas of improvement that we can look at in terms of healthcare settings. And the good news is that the Victorian government is currently aiming to address some of these access issues by opening a number of regional health and sexual and reproductive health hubs across the state. Further improvements to access could include solutions like expanding nurse-led models of care for sexual and reproductive health. We have heard from women that they often feel more comfortable bringing up questions around menopause and other related topics with a primary care health professional dedicated to addressing sexual and reproductive health rather than during a general appointment. So there is good news and there is progress at the moment. As many of you may have heard, there is an inquiry into menopause and perimenopause currently happening on a federal level. It's open now for submissions and we're excited to see whether there will be a suite of recommendations around menopause leave or other workplace supports, which could be included at a policy-wide level. So without further ado, I will introduce the next video, which is around chronic pain and specifically endometriosis, and this video features Catherine.
Come out, pretty. Please, Mama, help me eat my Mom and Dad took me at the table. I told them about the pain and fatigue of feeling, but the doctor said the same thing as my mum. He was the only kid in my town. A friend of mine will tell me she was in the process of getting diagnosed for endometriosis. When I heard about his condition, I was blown away. He was asking exactly what I was feeling. So I did my own research online and I started to feel relieved that I might finally have found a reason for what I will feel. I would take the whole thing creating that women's voice to easily speak that consider especially in small town. I wish that my teaching had been more compassionate and had more caring around me to help. I wish my parents had a better understanding so that they had me more pain when I was younger.
Hi, I'm Alison Jones and I'm the Mental Health Lead for Women's Health London Mallee and a member of the Long Story Short team. That was Catherine's story, and it's a representative story of the common experience for women as confirmed by the recent Listening to Women's Voices survey that was released by the Victorian Government earlier this year. The delay and misdiagnosis of chronic pain conditions often related to sexual and reproductive health. When gender diverse people, girls and women, are told that their intense and lasting pain is part and parcel of having a reproductive system, what they often hear is that their pain doesn't matter. Undiagnosed chronic pain conditions like endo can lead to lasting physical damage like internal scarring, increased risk of depression and anxiety, and problems maintaining work or study routines. So what then are solutions that we might be able to draw from experiences like Catherine's? Like conversations around perimenopause and menopause, chronic pain and the potential causes need to be something we talk about with girls and women about early. Destigmatizing conversations around chronic pain conditions, menstruation and other SRH symptoms is an important preventative health measure, which can be embedded in schools, in community settings and within families with the right support. Health education approaches must be developed with a gender lens on pain, with information embedded in curriculums and health promotion activities to empower girls with information and encouragement to advocate for themselves and to familiarise themselves with the very real and often debilitating symptoms of endo. We've heard that women often wish they had more access to relevant health information prior to needing treatment. It is crucial to allocate funding for research into women's chronic pain and the various causes, as well as ensuring primary healthcare providers are aware through initial standard training modules or subsequent professional development around common sexual and reproductive health issues. Women have expressed the need for open and easy to understand communication with health providers. The expansion of nurse-led models of care in this area of sexual and reproductive health might be as an effective solution to increasing access to timely information and diagnosis of endo, as it would be for perimenopause, for menopause, particularly in regional and remote areas. The Victorian Government's inquiry into women's pain is a welcome acknowledgement, not only of women's pain and its link to gendered health inequity, but also of the importance of women as experts by experience. These perspectives shared by women across our two regions will inform and shape submissions to the inquiry. And again, we can't wait to see the recommendations to emerge. The final video features Lucinda with a story about pregnancy options in rural Victoria.
Growing up on a farm, there was a real close-knit vibe in our town. Everyone knows everyone, and the gossip can be pretty unforgiving, especially for girls. When I was 17, I became sexually active with my first boyfriend, and naively, we never used protection. At school, we had been taught about condoms, but I'd heard boys say that they didn't want to wear them because the sex wasn't as good. At home and at church, we were told we shouldn't have sex at all. My auntie worked at the chemist, and most of the people working at the supermarket checkouts went to my high school, so buying condoms from anywhere in town was totally out of the question. I didn't have my P plates or a car yet either. I waited and waited for my period, but it didn't come. I avoided the problem until I eventually told my boyfriend about 6 weeks later. He acted like it was my fault and broke up with me. I had to tell my mum because I didn't have any way to navigate the situation alone. I knew I wasn't ready for a baby, but I was so nervous about how my parents would react. I thought my mum would go ballistic, but she was actually so supportive. She told me that she was proud of me for being brave enough to tell her. She even helped me tell my dad, and even though he was disappointed at first, he eventually hugged me and said that everybody makes mistakes. I was so relieved when my mum asked me if I wanted to discuss options and seemed open to the idea of an abortion. We agreed that I should go see a doctor in a bigger regional town near us. Luckily, my parents showed up for me. I think that things like affordable and reliable public transport and Medicare covering the costs associated with abortions would be really helpful to a lot of young women. After the whole experience, I found out about 1-800-MY-OPTIONS, which I think is a great way for people in the country to find information about where to go and what to do. My parents supported me, but I want more services to support country girls in my situation who might not have family support.
Good afternoon, everyone. I'm Mary from Women's Health Goulburn Northeast Health Promotion Team, and I'm also part of this amazing project, Long Story Short. So Lucinda's story brings to us a rural and regional lens to sexual and reproductive health that is so important when considering access and privacy issues. We've heard from many women about the difficulty maintaining privacy in small communities and how this has impacted their experience seeking healthcare. So when choices are limited in smaller rural communities, young people can face seemingly insurmountable barriers to accessing the care they need. So stigma, education, and privacy can all play a part in this, but also issues of access like transportation, cost, and information provision also has a major role. So we've heard that sometimes the SRH information is available, but young people don't know where it is or where to look for it. So what solutions can be identified from Lucinda's story and others like it? First, we need to take a broader look at health access and what communities need to facilitate it. So we must take measures to ensure that services like 1-800-MY-OPTIONS, Sexual Health Victoria's new SRH telehealth line, and other telehealth services are accessible to young people living rurally. And that's not all. We also need to make sure information about the location and function of the closest SRH hub is readily available to all. In fact, many women we spoke to were unaware of these services even when they needed them. So this is reflected in the quantitative data as well, which at times points to a disconnect between the number of services available and communities' perception around availability of those services, demonstrating that availability does not always mean accessibility. Moreover, professionals and institutions responsible for educating young people around sexual health in smaller communities can promote these services. They can engage in capacity building and tailored support for those delivering sex education to ensure a sex-positive approach which addresses the common gaps in practical knowledge around where to seek help. It is important in terms of networking that the health professionals, community pharmacists, and services working with young people are aware of referral pathways in smaller rural communities. And we have heard that traveling to specialist appointments is often necessary for rural and regional residents seeking SRH care. Ensuring there is adequate infrastructure like telecommunications, public transport is also an important facilitator of access to services. And we know that the reduction of V-Line train fares has improved cost of travel for many, but there are many areas that are near a train line or only have infrequent services. Therefore, increasing the frequency of train and bus services and more options of telecommunications for rural and regional communities across the state would also significantly improve access to healthcare. On that note, I'll now pass it back to you, Renata. Thank you so much.
Thank you. What a wealth of insight we can glean from lived experience. And thank you once again to all of the Long Story Short team for unpacking these themes further. It is a hopeful time, as has come up lots of times throughout this webinar. It's a hopeful time for the improvement of health and wellbeing equity right now, particularly in Victoria, but across the country as well. And we've heard through Jane's story that there is the need for improvement in how we understand, talk about, invest in and respond to the needs of women and gender diverse people experiencing symptoms of menopause and perimenopause. We can also see that there is movement in this area. As mentioned earlier, the current federal inquiry into menopause and perimenopause demonstrates an acknowledgement of the need to ensure women are supported in the provision of healthcare and in the workplace throughout all life stages. Similarly, Catherine's story brings to light the ways in which gender inequity has entrenched inadequate attention to and understanding of women's chronic pain due to lack of attention to women in research and education. However, this too is being recognised with the Victorian Government's inquiry into women's pain currently open for submissions. Finally, Lucinda's story emphasises the additional barriers to accessing timely, affordable and appropriate sexual and reproductive health care for women living in rural and regional areas. While there is a long way to go before living in the country ceases to be a factor in inequitable access to services, there is a genuine commitment to improvement by the state government outlined by the Victorian Women's Sexual and Reproductive Health Plan 2022 to 2030. Recent improvements to access have included the opening of the 12 sexual and reproductive health hubs, the removal of red tape in accessing medical termination of pregnancy, and innovative programs, as has been mentioned, 1800 My Options and Sexual Health Victoria's new telehealth line. And lived experience too is playing an increasingly important role in understanding the gaps in sexual and reproductive health access in regional Victoria. In addition to our project, initiatives like the Victorian Government's Listening to Women's Voices survey and other place-based projects such as Women's Health Grampians' Tell Your Story project are acknowledging women as experts by experience. This collective momentum towards improving health and gender equity provides the opportunity to create meaningful, sustainable change when it comes to women's health and wellbeing. The time to invest in women's health and wellbeing for a more equitable Victoria is now. So, what is the next step in the Long Story Short project? The valuable lived experience perspectives and the supporting data that we have gathered through this project will be outlined in an upcoming advocacy report, which will include a suite of recommendations. This work will inform our ongoing advocacy, planning and resource development and will soon be available for the public to view. Now we have reached the point where we have a little bit of time for a Q&A session. So Tricia and I welcome any questions that you might have.
Yeah, thanks, Renato. I can't see any questions in the chat at this point. I'm just checking. Is that correct? None there? So, Renato, just while we're waiting for people to quickly form their views, and we won't take too much long if there aren't questions appearing in the chat. I guess the thing is, you know, what we've been hearing and how powerful those film clips are, because they are real women, they are real women's real words reflecting their experience. So that experience is unrefutable, and that's how we get to better know, don't we, where both the shortcomings are, but also the learnings around what might work well for them. But we do have a question, and that is, what would workplaces be doing to support women experiencing perimenopause? Question that's come up. Would you like to start that one off, Renata?
Yeah, I think one of the things that come to mind immediately for me around workplaces is aligned with flexible working environments as well, and being able to support policies that broadly support that also come into also then have a knock-on effect of being able to support that. And we know we've heard about menopause leave coming up as a topic as well. So yeah, they're just a couple of things that come to mind for me.
Yeah, beautiful. Thank you for that. We've also got a question just posed there. So what's the ongoing advocacy with these videos? I wonder if we could even throw to some of our long story short team in terms of next steps, or do you have something quite specific that's coming next, Renata?
I think the like the reasoning behind creating these videos is to offer that different medium in which to engage people in this discussion, and I think that yeah, that gives us a conversation starter and another resource in a different way.
Yeah.
That we've got like fact sheets and a lot of the resources that are in the chat, but it's another way to hear the experiences and to create that discussion, I think. But yeah, if anyone else from the project team would like to add more.
I'd just like to say that it's really important to connect with women's stories. Often we read facts and figures and statistics, and it doesn't really hit us on that personal level. But what we have to understand is that quality of data does do that, and I think it's a nice way to absorb it in that narrative form. So yeah, these videos will have a place on our website, and yeah, hopefully people connect with those stories.
Mm. Thanks for that, Catherine. They are just so powerful, aren't they? And I guess we can see them absolutely, as you've said, Renata, as both conversation starters, but also an important way to turn what would we call, you know, the numbers into a really powerful way of understanding what those gaps are and opportunities. We've got another question. It's how will you measure the impact of this campaign? Will it involve going out and speaking with the community? Well, that's a lovely question to get. So I'm going to let the team think about that as well, but I'll probably lean on Renata just to start us off with some thinking.
Yeah, I think as we've noted that 5 years on from the original Storylines project, we're seeing the similar themes are still there, because these are such yeah, they're determinants of health issues, the access and privacy and stigma. They're big, complex things, and I think yeah, I think being able to use these videos and try to recognize some subtle shifts where we're only going to yeah, see some kind of emergent change. And I think if we yeah, continue to have those conversations, we'll see the norms and the practices gradually change, like workplace policies is a really, really good one. That's something that directly we may not have that impact, but down the track, it's where we can have that influence at an advocacy level in changing policy for the better.
Yeah, sorry, Tony, just having me reflect as we go that, you know, the power of actually, you know, speaking with the community and these video clips being part of those conversations, it's really bringing the stories back to women. And so that stimulates both a sense of a shared experience and can address some of that isolation that can come, particularly in our rural areas, of the experience you have. And, you know, and I guess the thing is that all of this work sits within a framework of monitoring and evaluation in the women's health programs. So we know that we are measuring how we make a difference, and we check in with women to make sure that we are making a difference we think can be made, as well as, you know, obviously I'm saying obviously, but importantly, into the systems. So there are many other partners and organisations who are part of that system. So I'm just watching the time as we go. And I might just go to that last question that we have there, and that is, how could other organisations support the advocacy that, that this long story short project provides? You got some thoughts there, Renata?
Certainly the videos are one way to share, and yeah, we want them being utilised and being watched and all of that. So that's one way to support that ongoing advocacy. And yeah, as we get to the final stages of the project as well, we mentioned the report with the recommendations. So yeah, there's certainly opportunity there to link in, and of course we do lots of our initiatives in partnership with other organisations, because we recognise that many organisations are working across our regions in this space. So yeah, it's a collaborative effort to address the recommendations and to move forward.
Yeah, so true, Renata. And we know that a good number of our partners are actually on this webinar, so they'll be looking to see, you know, well, be thinking about these resources and how they might engage them as well. So we really do welcome that activity and action that might come from the presentation. Renata, I think we've worked you fairly hard here, but we will go back to you just as we wind up, if you'd like to just bring to a conclusion the webinar today.
Thanks, Tricia. Yep. Yeah, thank you so much, everyone, for those great questions, thought-provoking questions, and we look forward to your continued engagement across the project. We've got the links in the chat, findings from the Long Story Short project, and being able to sign up to receive our report when it's complete. And of course, you will have seen there were many other links to services and resources mentioned throughout the webinar, which were also in the chat, but we can provide these in a follow-up email that we will be sending out, along with a recording of the webinar to all registered attendees. So lastly, on behalf of all of us at Women's Health Goulburn North East and Women's Health Loddon Mallee, thank you for joining us today. Please don't hesitate to contact us if you have any questions around the Long Story Short project, and congratulations to everyone on the Long Story Short project team. A wonderful effort. Thank you.
Beautiful, well done. And as everyone will see in the chat, there's an evaluation form we'd love you to fill in, because we do want to know yeah, how this has worked for you today as well. Thank you, everyone, for your attention. Thank you so much, Renata. That's just such you know, beautiful insight we received from you and the team. Pretty fabulous team. And all I can say is the ability of women in the moment to find solutions for the resources was well and truly demonstrated today. So a special shout out there to Azzy, who was able to make the videos connect. You've all got the YouTube links, and we know you'll be able to listen again. So thank you, everyone, as well. Cheers. Thanks, Lou.